A facelift, or rhytidectomy, is a surgical procedure aimed at reducing visible signs of aging by tightening the facial skin and underlying tissues. The procedure begins with administering anesthesia, typically general anesthesia, or intravenous sedation, to ensure patient comfort throughout surgery. The surgeon then makes carefully planned incisions, usually hidden along the hairline, around the ears, and sometimes beneath the chin, to minimize visible scarring. Through these incisions, the skin is gently lifted to expose the deeper layers of facial tissue. The surgeon tightens and repositions the underlying muscles and connective tissue layer, known as the SMAS, to restore a natural, youthful facial contour. Excess fat deposits may be sculpted or removed to enhance definition. Afterward, the skin is smoothly redraped over the newly contoured structure, and any surplus skin is trimmed away. The incisions are then meticulously closed with sutures or skin adhesives to promote optimal healing and reduce scarring. Finally, bandages are applied to support the tissues and minimize swelling. Recovery begins immediately, with most patients experiencing gradual improvement and returning to normal activities within a few weeks, ultimately revealing refreshed, rejuvenated facial features.